Hello, my name is Zeina. I'm gonna be talking about my presentation, community profile, priority population, black females age 45 to 64, education less than a high school diploma, income less than 25,000 annually, location Broward County, Florida. Health profile, top 5 issues: overweight, obesity, arthritis, depression, asthma. Comparison to Florida state: similar chronic disease patterns statewide, higher burden in low income communities, education level influences outcomes. Health resources in Broward County: public health clinics, FQHCS, community outreach programs, fitness and wellness initiatives. Comparison to Palm Beach County: Palm Beach has more accessible wellness funding, more community health programs, more transportation supported services. Health issues and behaviors. Overweight behavior: many women do not meet the recommended 150 minutes of weekly physical activity. Limited access to safe parks, sidewalks, and affordable exercise spaces. Low physical activity leads to lower energy use and increased weight gain. Environmental and safety barriers make staying active difficult. Overweight evidence. Research indicates that adults who fail to meet the recommended physical activity levels are very likely to be overweight or have a high BMI. When physical activity is low, energy expenditure will also be low, and thus it will be easy for the body to store the extra calories in the form of fat. A national study revealed that adults living sedentary lifestyles were more likely to be overweight than those who exercise regularly. The CDC states that community exercise programs are effective in increasing people's activity levels and thus reducing overweight rates in adults. Where there is a lack of safe and good quality exercise space in low income areas, it is likely that overweight prevalence will be higher. Engaging in physical activities is one of the ways the body stays healthy because it helps the body to regulate metabolism, muscle mass, and body fat, which are the major factors that lead to overweight. Obesity behavior: hardly consuming carbonated drink, sweet tea, and energy drinks, regularly consuming processed and fast food that's salty, sugary, and made with unhealthy fats, not having enough fresh fruits and vegetables and nutritious groceries that are affordable in low-income neighborhoods. Obesity evidence: SSB intake linked to higher obesity risk. Low-income areas have higher soda consumption. Arthritis behavior: low levels of physical activity due to joint pain or stiffness. Avoiding movement or exercise because it feels uncomfortable or difficult. Not using joint-friendly exercises that help maintain mobility. Arthritis evidence: limited access to arthritis-friendly programs contributed to lower mobility and poorer overall health outcomes. Joint-friendly exercise has been proven to reduce pain, improve strength, and support weight management, which lowers arthritis burden. Depression behavior: irregular sleep pattern, including sleeping too much or too little. Emotional eating or skipping meals due to changes in appetite. Difficulty maintaining daily routines or self-care habits. Depression evidence: according to research, one of the main consequences of depression is decreased physical activity, which eventually leads to decline in the general health condition of a person. The Centers for Disease Control and Prevention (CDC) indicates that adults with depressive symptoms are that much more likely to complain of ill health and even report the occurrence of chronic diseases. Scientific researchers have been able to identify that social isolation and lack of support as factors that lead not only to the onset of depression, but also intensify the symptoms of this mental disorder. Depression has been linked with changes in sleeping habits that, in turn, may lead to an unhappy mood and difficulties in daily living. Organization. Organization description. The Broward Health and Wellness Coalition is a local group that aims to make less fortunate people in the Broward County area healthier. The Alliance offers educational programs about health prevention for chronic diseases and activities outside the health institution sphere. Through their efforts, these areas become more vibrant as the low-income neighborhoods are provided with greater access to wellness resources, health checkups, and health programs. Mission statement: to promote equitable access to health, education, support healthy lifestyle behaviors, and reduce chronic disease disparities in Broward County communities. Program goals. Goal: health outcome of Black females aged 45 to 64 are to be better through the means of engaging them in physical activities, improving their diet, and lowering their risk factors related to overweight, obesity, arthritis, depression, and asthma. Reasons: the goal corresponded with the changed population that was targeted. Covers the issues that are the major source of chronic diseases for the group. Help maintain good physical and emotional health in the long run. Planning committee. Public health educators are the ones who prepare program content and conduct sessions. Community leaders deliver the cultural perspective and can be reached for the support of the dissemination. Healthcare providers, nurses, dietitians, counselors help to define health topics and conduct screenings. Behavioral health specialists talk about depression and teach stress management techniques. Program coordinators are the ones who manage the time, relationships, and materials. Community volunteers play the role of event recruitment and program activity facilitators. I hope you like my presentation, and